Well, erectile dysfunction is a very common problem, and very few men are willing to admit it or even talk to the doctors about it. 20 to 30 million men in the United States may have the problem, but most of them are not diagnosed. And there are many causes. I mean, erectile dysfunction could be caused by hormonal problems. Testosterone could be low in some men. As we age, testosterone goes down. Could be vascular problems, meaning blood flow to the penis is impaired somehow. Neurological problems, actually problems with the nerves that go into the penis. And psychological problems, either depression, anxiety, problems with your partner, with your spouse. So there are many factors affecting a strong erection. It's actually amazing that as we age, we still get erections, some of us do, because there's so many factors involved. So when it comes to the psychological causes of erectile dysfunction, anxiety, depression, fatigue, being tired. When you're tired, you don't feel like having sex or can't even get it hard. Guilt, shame, related issues around sex. Drug use, like, crystal meth. There are other causes that are related to health. People with cardiovascular disease, heart disease, high cholesterol, triglycerides, may have issues with vascular flow into the penis. Surgery of the colon, bladder, prostate may also cause the problems. Neurological causes, lumbar disc problems, lower back issues. Many of us are walking around taking a lot of medications, blood pressure meds, psych meds. The term polypharmacy is used in conferences. We're polymedicated. We're a polypharmacy population. And as we get older, we add more and more medications because of the different things that show up with age and HIV. So those things can all interact. What kind of things can we do? And lifestyle changes. We can eat less animal fat and cholesterol in our diet, not drinking so much alcohol, maybe 1 or 2 drinks a day, no more than that. Eliminating or not smoking at all. Smoking is probably the biggest problem when it comes to erectile dysfunction, lung disease, you name it. Everybody knows smoking is not good for you. But if you really want to keep it hard, smoking is not something you should be doing. Weight loss, if appropriate. If you're overweight, people that have high body mass index tend to have more issues with erectile dysfunction. And exercise. It's always all about exercise. Exercise, really strong data showing people that actually exercise 3 to 4 times a week tend to have less problems with erectile dysfunction. As we all know, we have Viagra, we have Cialis, we have Levitra. So people think, well, just take a Viagra and your problems will be solved. Actually, there's a 40 to 50% failure rate. The side effects of Viagra, Cialis, and tadalafil are headaches. Some people get flushing, they get red, sinus congestion, heartburn, diarrhea, backache. I know people that take Viagra and they take a Claritin for their nose, an Advil for their headaches, and a Lamotto for their, or Modium for their diarrhea, So they're taking a few other drugs to counteract the medication side effects. The problem with all of these drugs is that very few to no insurance companies, Medicare doesn't pay for them, don't pay for these drugs. So people are paying out of pocket. And these are expensive. In the United States, they're ripping people off with pricing. Men are going on the internet and buying it from overseas at a lot lower cost, and that's not illegal. In this country, you can import for your own personal use enough for 3 months supply. There's another product called Muse, which is a pellet. It's a suppository that you actually put down on your urethra. But it's not very popular for obvious reasons. But you can get a prescription. It's called Muse. And they're injections. And they're, using a very tiny insulin syringe with a very tiny needle, injecting a very tiny amount of 0.1, 0.2 cc's. These products work really well. They work too well sometimes. And that's dangerous. When you're having an erection that lasts more than 3 or 4 hours, there's problems could occur. I mean, people say, oh, that's wonderful. I could have an erection for a long time and have sex for a long time. And yet, if you have blood sitting on in your penis for that long, it can coagulate, and you can actually get gangrene in your penis. So it's not a good thing to have a long-acting erection for a few hours. So that's the only problem with those injections, that if you do too much, you don't know what you're doing, you may end up in an emergency room. So it is important for men that are seeking other options beyond Viagra, beyond Cialis, to talk to a urologist or a doctor that actually knows how to titrate that dose and make sure it works without any of these dangers, because it is not fun. They're vacuum constriction devices. It's like a tube where basically it's like a pump where people actually just create a vacuum and their penis gets erect because blood is flowing into the penis due to the vacuum. And then they put basically a cock ring on the base to keep the blood from flowing back out. For people that nothing else works, there are penile implants, prostheses. They're put in the penis with a little hand pump, like an air pump, that fill up the device, and people can have normal erection that way. Well, another reason, another cause for erectile dysfunction is testosterone deficiency. When people have symptoms of testosterone deficiency, they usually have no sex drive, erectile dysfunction. They're tired. They may be depressed. They may lack motivation, lack of mental focus. The only way to get diagnosed is to complain to your doctor that you have the symptoms. Your doctor will then ask you a few questions, usually related to sexual function and fatigue and all that, and then test your blood for testosterone. And by your blood levels, the doctor can say, yes, you're low, or you're high, or you're low normal, which is not uncommon. And then the doctor may provide options for treatment. There is the old-fashioned injections. So you get an injection either once a week or every 2 weeks. There are several gels in the United States. There's the Testim, Androgel, Oxyron, and FORTESTA. All of them around $700 a month. Most insurance companies pay for it. Medicare pays for it, Part D. Testim has a smell. Some people have a problem with the smell, but the company says it gets absorbed better. Androgel is very popular, #1, probably in prescriptions. It's available in packets, in a pump. And the pump is kind of fun because if you have to increase the dose, you can pump some more. Oxyron, it's like a deodorant under the armpit. They put gels on, or they're holding their spouse, their female spouse, or kids. They can transfer some of that testosterone to the other person, and that's not a good thing for kids. FORTESTA is a 2% gel. Androgel, Testim are 1%. Another gel that most people don't talk about is the gels that are available through compounding pharmacies. Once again, these pharmacies can make creams or gels anywhere from 1% concentration up to 10%. Even cheaper by ordering it through a compounding pharmacy. Patch, the Androderm patch, popular. It used to be popular before gels came through. And the pellets. They're little tiny pellets, like a rice-size pellets that are inserted under the skin, mostly in the buttocks. Release testosterone very slowly for around 3 to 4 months. Doctors have to be trained on how to insert them. And sometimes there are infections related to that. Okay, there are 2 products that may be approved within a few next months in the United States. One called Nebido, which is testosterone undecanoate. It's a long-acting injection, meaning you inject every 3 to 4 months, and that's good enough. Your blood levels go up and stay up, which is pretty practical. Almost everybody I know has made mistakes when starting testosterone replacement. The first mistake they make is that they start a product, whatever it is, and they don't get retested to find out where they are, what the blood levels are. Second problem, cycling on and off testosterone. People say, well, I need it for a while, but I'm going to get off of it. What happens when you're on testosterone? Your own body's production of testosterone shuts down. People that do testosterone, yet they don't have a lifestyle that improves testosterone. They keep eating like crap, not exercising, smoking, drinking, and yet they expect testosterone to do the job. And not switching doctors when you have to. And I tell people, unless you're really stuck with one doctor because of your plan, or you're going to a free clinic and there are reasons to be stuck with one doctor, there are doctors out there, and there's a whole chapter in my book on how to find a doctor that is trained on testosterone replacement. Even at low doses of replacement, we could have some side effects. Increased blood pressure in some cases, acne. Some people may get acne due to DHT, one of the metabolites of testosterone, because testosterone can worsen prostatic cancer. Testosterone does not cause prostatic cancer, however. And some doctors think testosterone affects the liver. It doesn't affect the liver. And the gynecomastia, the increase of estrogen and breast tissue in men, that could be an issue too. And there are drugs that can block that effect, okay? First of all, don't be ashamed to speak up to your doctor, okay? Get tested for testosterone deficiency, get in shape, exercise, eat clean, healthy, alcohol to a minimum, don't smoke, and enjoy sex, without shame, because there's some issues related to sexual dysfunction and shame issues.